Good afternoon. My name is Arness Krause, and today I'm going to be presenting a case presentation for one of my clients who is a 26-year-old Caucasian female. She lives in Sneads Ferry, North Carolina, but is originally from Ohio. She and her husband have recently separated from the Marine Corps, and he was medically retired with some serious medical issues. Prior to her marriage 6 years ago, she was at home with her parents, attending school. She reports having a really good relationship with her parents. She felt very supported, very loved. She's educated. She went to college and completed university. The reason for her visit to me was because she lost her father last year very dramatically, very unexpectedly, and she has been experiencing very extreme forms of grief as a result, and she just doesn't feel like she's able to move forward with her life. She feels as if this grief is really impeding her ability to do her day-to-day activities. She often feels depressed, not able to get up, not able to bathe and engage in proper hygiene. She often forgets to eat or overeats to compensate for her emotions. And she's also expressing a very high level of anxiety as a result of the type of death. It was an accidental death. Again, it was unexpected. And so when she relives that, it becomes very traumatic for her. When we began, we did several assessments to look at what might be underlying her grief and to determine her level of grief. So her original assessment was the Purgerson and Majewski's complicated grief assessment tool, where all four of the criteria were not only met but exceeded, as well as the PHQ-9 patient depression questionnaire to determine where she was, and she scored 20, indicating severe depression. So, you know, the diagnosis that I came up with consulting with the DSM-5 and based on those assessments, ruling out, of course, normal bereavement, any physical disorders, medications, or other biological issues, I came to the diagnosis of major depressive disorder based on meeting the criteria for A, 1, 2, 3, 4, 6, and 7, B, and C. She has been in previous counseling before, and that's really benefited her. So I felt like we could build upon her previous treatment. She did indicate that she had previously been diagnosed with post-traumatic stress disorder as a result of being verbally abused by several of her athletic coaches throughout high school and college, which really affected her self-esteem and sense of self. So in her prior treatment, she was receiving cognitive behavior therapy, and I thought that would be a good place to start with her, looking at some of her core beliefs, her immediate beliefs, and some of her automatic thoughts. She's been progressing great. She is beginning to do a lot of cognitive restructuring at home. We also discussed medication options for the depression, and she would rather not take any medication and see if the CBT helps relieve those symptoms rather than going on medication. So we've been working on cognitive behavior therapy. We've also, client also wants to work on those self-esteem issues she believes are a result of the stress, the PTSD. So we've been looking at again using CBT for that, but also a little bit of motivational interviewing, because some of her self-image or negative self-image is a result of being very overweight and being unhappy with that. So we looked at some motivational interviewing for making diet changes and exercise changes. To date, she's doing really, really well. When she first came in, she was on a scale of 1 to 10, about a 2 or a 3 in terms of depression and grief and anxiety. She was over the top. Right now, she's scaling much lower in the depressive anxiety and increasing in her self-awareness and her self-esteem. So she's doing really, really well. She's done really well with her homework, and we are going to continue working with mindfulness and meditation techniques as a way to cope with any reoccurring episodes of depression and anxiety in the future. We are transitioning in the next couple of weeks, and the client feels ready to do so. Thank you.